Thank you. And just one more. This week, the assignment that they've had was to place the riders in the saddles and do some evaluations and put the riders so that they feel their bony triangle, which is the two seat bones and the pubic bone. And when they find that, and they retest their stability by pushing them from each side, and they find that in that triangle they are way more stable. So that would appear to be the neutral pelvis, but the riders don't always look like the pelvis is vertical. Does a gymnast, for example, have a neutral pelvis when they're not quite vertical? So I'm a little I'd like to expand on that a little bit.
Right. So that I'm more than happy to expand on that. That is going into very deep anatomical knowledge or anatomy of the pelvis. And the pelvis is a very complex bone on a variety of different levels, partly because the way we commonly measure the neutral pelvis is from ASIS, which is the anterior superior iliac spine, to the PSIS, which is the posterior superior iliac spine. Now, the bony bit on the end is where your dimples would be, little hard bits of bone, just kind of where your sacrum is, just go out to the sides. There's little kind of hard, bony nodules you'll feel. That is called your PSIS, or sacroiliac joints is what they're also called as well. Now, the problem is with that is that depending on the pelvic shape, and we do touch on this later, whether you have what we call an android pelvis, gynecoid pelvis, platypoid pelvis, anthropoid pelvis, there are 4 generic types, but I go into detail in terms of that, we likely touch on it. That depending on your pelvic shape changes the angles of the neutral pelvis, or how we commonly measure the neutral pelvis. So you can be doing the triad and put the pelvis into neutral, but yet the pelvis from the lateral view and the measuring from the ASIS to the PSIS as a horizontal line suddenly looks out of kilter and it doesn't look horizontal. So there are things like that which we also have to be aware of. So yes, but we can go into a lot more detail onto that if you so want, but that's just briefly touching that.
Thank you. We're not bored.
But that's why I say the pelvis is a hugely complex subject, because it's you've also got, as I say, the different pelvic shapes. You've then got all of the pelvic abnormalities which can occur, and then you've got also muscle contractions and psoases and various things like that, which we all have to deal with. So yeah, well, I'm more than happy to go into a lot more detail on that if you want.
Well, we were just introducing the pelvis as it relates to the saddle and saddle design, and in terms of having the riders put in their own saddle. Then when we put them in what we believe to be neutral pelvis, or that bony triangle contact, what happens? And we've been looking at that. So anyway, over to you.
One of the big factors with the bony triangle is actually the position of the genitalia. That makes a massive difference. Because sometimes you can put somebody into a neutral pelvis or a neutral pelvic position, but because of their genitalia, you can't actually put them into that position because they end up, in the most polite way possible, they end up kind of mashing themselves, which is quite uncomfortable for everybody, really. So nobody wants mashed bits. So yeah, that's also another area which you have to. So trying to fit a man in terms of the neutral pelvis and the triad is going to be a very different experience. Is the most polite way of describing that. So as we kind of mentioned, there are 4 pelvic shapes: anthropoid, android, platypoid, and gynecoid. They are all slightly different in terms of their shape, their position, and their angles. But one thing which everybody must understand is that very few people are one group. You're not. It's a sliding scale. So that what happens is you may be, as I kind of said there, 90% android with a 10% anthropoid shaped pelvis. Or you could be 50% platypoid, 30% gynecoid, 10% android with 10% anthropoid. This is because of your genetic history and your genetic lineage. those genetics are going to influence and change the shape of your pelvis. Now, the one thing which kind of most people do forget about in terms of pelvic shapes, which coincides with pelvic shapes, is lumbar spine positioning. So lumbar spine positioning is another extension of the pelvic shape. The reason why we say is because the lumbar spine, you have a lordotic curvature. What we mean by that is that the curves forwards or anterior towards the belly button. Now, if you have an exaggerated curvature, which can happen, you will see that curvature more often in a platypoid pelvis. Now, that will then change the angle of the pelvis. Now, there are situations where, because of lumbar damage or lumbar curvature, if you have an accentuated lumbar curve, you will never get that pelvis into pelvic neutral, because they've got such an acute angle in their pelvis that trying to put them into neutral will actually cause them more discomfort. So this is where, as a fitter, sometimes you have to kind of go, right, do I fit to the rigid guidelines of I must have this athlete or this rider in a neutral pelvis, or do I actually go, this person is functional, so it doesn't matter if their pelvis is anteriorly rotated by 5 degrees or 10 degrees, because they're not in pain, they're comfortable, and they're still able to move. Now, that is ultimately your decision, which you have to make day by day when you're doing the job. That's not necessarily for an individual, a company, or an industry to necessarily turn around to. We have, an industry should turn around and go, that is your aspiration to get a pelvic neutral, but it doesn't mean you have to do it, because sometimes it will cause pain and discomfort. So, yes, that is about the other thing which we're starting to talk, or people are starting to talk about, is the inherent pressure points which occur with the different shapes of the pelvises. Anthropoid pelvis compared to a platypoid pelvis, gynecoid compared to android. They load their distribution of force differently. Now, this makes saddle fitting even more complicated, because with a pelvis like a platypoid, which has a very wide ischial tuberosities, your loading points, your ischial tuberosities, so your seat bones, are very wide apart, and they're generally quite big, and they're loading straight down. Now, that pelvis, because it's quite a wide, flat pelvis, will rotate anteriorly, which means that they're also more likely to load up the pubis bone. Now, if they're more likely to load up their pubis bone, this in turn means their lumbar curve is exaggerated. So your loading mechanism now is more onto the pubis than necessarily the seat bones. Now, if you try and rotate that pelvis backwards, you're going to then overload the seat bones, lighten the front of the pelvis, but you may have a curvature in the back which doesn't allow that. So all of a sudden, you're trying to get the platypoid pelvis to a neutral position, and you just can't do it. And this is where, as I say, the pressure distribution is really fascinating, because in that situation, you turn around and go, is it worth it? Whilst with an anthropoid or an android pelvis, which is very up and down, the pressure points are going to be higher slightly, because their seat bones are slightly smaller. So, yeah, we have every pelvic shape has pros and cons. Now, obviously, we're talking about the pelvic shape in relation to lumbar curvature. We also have to talk about it in terms of shape and hip position, because it's something which I don't talk about here specifically, but you talk about the angle of the neck of the femur. Now, different pelvic shapes typically can indicate different angles of the neck of the femur. There's a lot of words when you're having to kind of talk about all of this together. So you've got so again, giving you an example, a android-shaped pelvis, which is a pelvis which is very up and down, very in the most polite way possible, a very Scandinavian, very small, skinny pelvis. You know, the people who have pelvises which are very, very small, very upright. Now, those hips which they have, their angle of the hip is also equally very upright because they have a very upright pelvis, because the angles of the socket joint is at a slightly different angle. So the problem is you're not going to get people with an android pelvis with a 90-degree bend or curve or angle in the neck of the femur. You know, they're not going to suddenly have an android pelvis and really wide hips. What they generally do is they have an android pelvis and they have a very narrow or upright angle of the head of the femur. Now that in turn changes how wide those legs can go, and it changes the articulation surface and the loading mechanisms and various other things associated with hips. Now, hips I can go on for hours and hours and hours about, and if you want, I can do that. That's quite happy because it's quite fascinating, because it's all hip ankles.
Before you do, I've got a couple of questions here. There's so marketing out there in saddle fitting in relation to male-female pelvis shapes. Do these 4 shapes apply to both sexes, or is one sex more prone to any of the shapes over another?
Right, so both pelvic shapes exist in male and female. They do, but there are stereotypically more variations or more extremes of variations within the female gender. So, for example, you will get men with what we call a platypoid pelvis. Those are men who, I'm going to say this in a terribly rude way, but those are the men who you look at and they are pear-shaped, for example. It means that they have a very wide-based pelvis. So pelvic shapes do exist in men, but you do not get the extremes that you do in women.